Okay, great. So we're talking about HIV/AIDS cases in Florida that were significant in really, I think, transforming the nation and the world. In part just because they represented one of a number of new emerging pathogens that appeared after the 1970s, when it was thought that the war against infectious disease was over, and that research, healthcare, could really turn their focus to chronic diseases. Well, what happens is in the ensuing decades, you see the rise of emerging pathogens, including Ebola, and certainly not limited to Ebola, Lassa, hantavirus, Legionnaire's disease, Lyme disease, a host of others, all that kind of cause changes in the way that we do research, the way we think about disease and healthcare. But I think, and I would argue, that HIV/AIDS really has had the largest single impact. It's really been most involved in changing the way we think about disease, we think about the future of healthcare, the way we do research, the way we spend money on healthcare. So healthcare itself, research, but also the legal system, and so how we minimize these guys. Okay. So really have caused changes in the legal system, how as a society we respond to crises. We don't necessarily have it down pat, but we do now have in place ways in which we can respond that are a little bit more structured than our first responses to HIV/AIDS. And then just, I would say that it has had a transformative impact on society. And we can all think about ways, maybe personally or otherwise, in which we have been been changed by HIV/AIDS. Today we're examining two high-profile Florida cases that were involved in these changes, as I mentioned before. They made the news, they forced changes in the legal system, and also impacted how people with HIV/AIDS were viewed in the United States. I was going to do a brief background on the HIV virus. I'll make it very brief. I think a lot of people here are familiar with this history, but just to kind of put it in context, it's similar to a simian immunodeficiency virus found in chimpanzees in West Africa. It's been hypothesized that the transmission to humans and mutation into HIV probably happened around 1920, and probably in the Democratic Republic of the Congo. And that was also the time when a disease that made the jump from animals to humans might be more likely to become kind of a permanent mutation. If there were an isolated village in the past, a mutation might not spread beyond there. But at the time when this happened, Kinshasa was a center of transportation, roads, railroads, rivers. There's also a growing sex trade. And so the disease was believed to spread from Kinshasa to Brazzaville. And both of these are maybe not necessarily that far away, but it's moving it from one colonial power to another with the potential to spread certainly to different parts of Europe. The earliest sample of infected blood came from someone that died in the Congo in 1959. And in 1959 also it's believed that someone who died of the pneumonia that's kind of indicative of someone with a compromised immune system died in 1959 in New York City, but it was someone from Jamaica. So the growth of trucking routes, which you see in this picture, helped spread the disease through Africa. It's believed to have kind of come maybe more permanently. We saw one case in 59, but maybe more than just a single case in 1966, probably in Haiti. There were a number of Haitians working in the Congo at that time. So came to the Americas, spread to the U.S. in 1968, and someone who died in 1969 in St. Louis, blood samples may have been HIV. So probably coming to the U.S. Maybe more or less permanently in the 60s, late 60s, but it became recognized only in the 80s. So in 1981, physicians began to report clusters of rare cancers, Kaposi sarcoma, and that pneumocystis pneumonia, which is found in people who are immunocompromised. By the end of 81, 270 cases of immune deficiency were seen in gay men. So in the U.S., AIDS obviously really appeared, and I'm sure everyone knows this already, was seen as primarily a disease of gay men. And for a time, it was thought that there was some substance other than an infectious agent that was responsible for AIDS. So for a time, there was a close examination of the gay lifestyle to try and find the cause. But as cases increased in number, AIDS clinics opened in San Francisco in 82. AIDS is suggested as a name instead of GRID, which was gay-related immunodeficiency. By 1983, AIDS in heterosexual women had been reported, but the main primary victims of HIV, at least those recognized in the U.S., were what they called the 4 H's, homosexual men, heroin users, or essentially drug users sharing needles, Haitians, and hemophiliacs. And I'm not going to go into all the details about this, but I just wanted to give kind of a timeline of how things were changing at this point. By 1983, there were occupational safety guidelines for the disease, and by 83, the CDC was saying casual contact was not necessarily going to transmit AIDS, although that, and we'll talk about that, that wasn't necessarily accepted until much later. So even with the guidelines in place, by 1984, Ryan White, who was a young man with hemophilia, and of course hemophiliacs were very much at risk because they were dependent on blood products, and the blood supply at that time was not being screened for HIV/AIDS, and many of the hemophiliacs in the country came down with the disease. But one of the issues in the early years of AIDS was that hemophiliacs, because the idea of the casual transmission hadn't been completely removed, many hemophiliacs were prohibited from attending school. There was a lot of fear surrounding their whether or not they could transmit the disease to other children in the school. So Ryan White, in 84, he was prohibited from attending school. By 85, he was diagnosed in 84. By 85, he was really on his way to becoming a spokesperson against AIDS stigma and discrimination. So you're seeing all of these changes and many of the responses. Overall, we can think about transformations that were happening at this time, that while the nation was responding with fear and with research to try to gain more knowledge, there were significant changes that were happening. Maybe we could argue that these are long-term changes. Some of these were really what transformed healthcare. This is from a video interviews with physicians and healthcare providers at San Francisco General, which was really at one of the ground zeros of the AIDS epidemic, talking about, here in the case of a surgical resident, how surgery was transformed by AIDS by the 80s, where it was recognized that it could be transmitted through the blood, and so this old surgery had really changed, and he goes on to describe how surgery then became much more about trying to prevent contact with blood because it wasn't possible to determine whether patients were, especially in trauma service, whether they were HIV infected. Healthcare is transforming in other ways as we see the society responding to HIV and AIDS. In this case, a nurse who was working in San Francisco General at the time, talking about how the issues of many people dying, but many people who are facing discrimination because of who got the disease, because it was kind of unknown, or many in the population didn't believe it was casual contact. Many of those suffering from AIDS really faced discrimination, felt that they were outcasts, and so one of the ways in which at least healthcare in San Francisco General transformed was to create an environment that was much more accepting, where it was caring, where they were partnering with the patients. And creating a model of patient-centered care at San Francisco General. Throwing the rules out the window and changing and saying patient-centered care, the patient themselves gets to say who comes in the room. So while healthcare is transforming, what else is happening in the sense of kind of overall responses? We looked at some of the specific changes and the specific events. So early cases were found in marginalized groups, as I've mentioned earlier, feeds the stigma that's associated with those who have HIV, who have AIDS, a slow government response. So while when you look back, it's a few years, and that seems quick maybe in retrospect, but at the time, people were dying. And so if you were watching your loved ones die, if you were seeing your hemophiliac son become infected, the fact that the government by the 1985, 1986 was only beginning to respond really made it difficult for those who were intimately affected by the condition. Because the modes of transition were first uncertain, I personally remember in the 90s there was still some question of whether you get from a mosquito bite or from saliva. That in turn kind of fed the fear, fed the response to those who were infected. It was identified as an STI, a sexually transmitted infection, so that increased the stigma. We have a tendency to see STIs as something that people get because they're immoral or they're doing something that they shouldn't do. A lot of fear and uncertainty were happening, were part of the society, and the result was that there was a tendency to avoid HIV positive people. You saw that with Ryan White, or even those who treated or were exposed to HIV positive people. We heard stories of those who worked with HIV positive whose family kept their distance from them. And I think also significantly it was a deadly disease. So we think about the responses. Sometimes they may seem overblown, but people died from HIV AIDS before there was treatment. It was more or less 100% fatal, 100% mortality. The immediate response to these cases in Florida, which I'm going to get to in a moment, really raised debates about the question of transmission and who gets sick, kind of going back to the idea of blame and stigma. How is it transmitted? And we see that community response to ostracize and exclude. And to kind of get back to the first point, it also exposed our ideas of guilt and innocence about, does someone, if you have to do something to get a disease, does that make you guilty? So in 1986, in our timeline, there are a lot of things that are happening, two of which are the creation of the AIDS quilt and an official name HIV for the virus. But for our interest, the Ray brothers were diagnosed with HIV. Now, the Ray brothers, Randy, Robert, and Ricky, were all hemophiliacs. Their case became public in 1986 when they were tested positive. They lived in Arcadia, Florida, where their parents were born. When they told their pastor that the children were HIV positive, they were excluded from church. And when their school learned of their status, the school board voted to exclude them from the school. And so we can...
They look normal, lively youngsters, 8-year-old Randy, 9-year-old Robert, and 10-year-old Ricky. It's hard to imagine that they're victims, not just of the AIDS virus, which they all carry, but of the fear and ignorance of their neighbors who shun the boys and treat them like lepers of old.
It's just like they just turn around like never exists.
The local school refuses to let the boys in the classroom. When their parents turn for comfort to the church, their pastor spreads the bad word through the town and bans the family from church.
I am nothing afraid of AIDS disease. Anybody that says they're not afraid of AIDS is a fool or a liar.
They spend most days fishing, but even on the riverbank, grown-ups flee when the boys come too near.
I'm going to stay out here.
When their parents turned for comfort to the church, their pastor spread the bad word through the town and banned the family from church.
I am deathly afraid of AIDS disease. Anybody that says they're not afraid of AIDS is a fool or a liar.
They spend most days fishing, but even on the riverbank, grown-ups flee when the boys come too near.
I'm going to stay out here and fish, you know, as long as I can, but if they come this way, I'm going to take my family and move.
And the local barber shop has banned the boys as well.
They said that they weren't going to even touch our hair. They wouldn't cut it.
And they're going to have to look back one day, and I don't think it's too far in the future. They're going to look back and say, we treated them young and wrong, and there ain't going to be nothing they can do but just hang their head in shame.
The family are now suing the school board, demanding their sons receive an education. The boys just want people to understand and be nicer to them. Ken Reese, ITN, Washington.
So as you can see, the Ray brothers' experience really mirrored that of Ryan White and other children who tested positive and who were excluded from the school system in this early period when fear was still really predominant in the response to AIDS. Well, we heard from the video, which was aired in July of 1987, that they had been excluded from school. The local school board had prohibited them from going to school. The family took the case to court, and a judge overturned the school board ruling, so the Ray brothers attended school in the fall, going from July, and by fall it's actually August. Because the word had spread in the community, you already saw that the pastor of the time spoke out very strongly against the idea of contact with the children, and also showed us some of the fear that was really extant at the time. Again, remember, this is not to excuse what happened, but this is a time when there was a huge amount of fear about a disease that was deadly. But in Florida and in Arcadia, obviously, the reactions went beyond what happened, really, I think, elsewhere. Parents boycotted the school when the Ray brothers attended, and half of the children didn't come to school. But after a week of bomb and death threats, telephone threats primarily, on August 28th, a week after school started, their house caught fire. Only one member of the family, not the brothers, their parents, or their sister were home, and the person who was home was able to get out. But their house caught fire, and the family moved from Arcadia, first settling in Sarasota, and then they moved around Florida. As for the three brothers, Ricky Ray, who was the oldest, passed away in 1992. His brother Robert in 2000, and Randy Ray, who's the youngest, is still alive today. So obviously living into the period when the antiretrovirals became available and treatment for AIDS was possible. So we see the response to the Ray brothers in the 80s. What kind of impact did it have on society? Well, Ricky Ray passed away in 1992. In 1998, there was a law named after him called the Ricky Ray Relief Fund Act. It was passed. It was enacted in 2000, and it kind of represented the government's indirect acceptance of blame for failing to adequately screen the blood supply. Prior to that, there had been calls for screening the blood supply, and there were, again, talked about the slow governmental response. The response was slow enough, as I mentioned, for a large number of the hemophiliacs in the country to become infected, to die. And so the Ricky Ray Relief Fund Act essentially provided a compensation of up to $100,000 for anyone who received blood products between 1982 and 87, at least those with a blood disorder. And it allowed compensation for spouses of the individuals who acquired AIDS in that period and for their survivals. You know, the act has been criticized as a stop or as something that would then, because if you accepted that 100,000, you basically signed away your right to protest or to speak out against the fact that you're HIV positive. But it was something that came in response to the Ray's experience. It did immediately generated sympathies and offers of assistance from around the country, significant criticism of the community as well for what happened. But the sympathy and offers of assistance came from within DeSoto County as well. And the family requested that be put towards AIDS education in the community rather than accepting that assistance for themselves. And then other examples of how they impacted society. There's a blog of someone else who was a hemophiliac who became HIV positive because of the blood supply. And he said, "I thank Ryan White and the Rays for blazing the painful path that showed those in my own community," meaning his town, 25 years ago, that they would lose if they chose to take their case to court. So while the Rays showed some of the consequences, at least social consequences of following through, at least it kind of paved the way for others to insist or choose on attending school. Just so reaction in Arcadia today, I put an asterisk by it seemed to teach communities that not to try to legally exclude HIV positive children from school. It might have caused people to rethink their fear of infection. That's certainly something to discuss, is how much did people change their minds when they saw the consequences of prejudice. But according to an article in the St. Petersburg Times, Louise Ray has revisited Arcadia, even though they moved away from it. And while she was there, she was having a conversation with someone in the town who's HIV positive, and they didn't speak in hushed tones or worried voices. So she said, "Boy, have things changed. You couldn't have had that conversation 10, 15 years ago. Now, as a general rule, having HIV has become more acceptable. You're not considered a leper to be cast away anymore." So one of the two cases with the Ray brothers. The other case that is also very well known, this is not to say these are the only cases of early HIV in Florida, but these are the ones that really gained public attention, really kind of generated media response, and really seemed to be transformative. In 1990, Kimberly Bergalis tested positive for HIV, and this was the first reported transmission of HIV from a healthcare provider to a patient. You can see some of the other things that were happening in 1990 below, but the one we're going to focus on is Kimberly Bergalis, who then died in 1991. So Kimberly Bergalis graduated from the University of Florida, majoring in business. In 1987, she had 2 molars removed by the Florida dentist David Acker. He was HIV positive at the time, and Bergalis began to show signs of AIDS 2 years after that extraction and was diagnosed in January of 1990. And we'll watch a brief clip. Hopefully we won't get the same reaction of...
Acker's case is bringing national attention to our area tonight and to the increasing fears over how the AIDS virus is spread. Nowhere has the impact of AIDS been so tragic than here in our area, where a young woman is the first in the country to claim she contracted the deadly disease from a medical caregiver. The implications for you and for the health community are enormous. In the first of my 3-part Action News Extra on AIDS anxiety, you can meet the young woman who is bravely forging ahead despite the odds.
We're all going to die. You know, none of us are immortal. With AIDS, you're more aware of it.
She's a 22-year-old college graduate with a promising future until December 1989, when Kimberly Bergalis found out she was diagnosed with AIDS. Suddenly, fate change the future.
It's frightening. You know, I was at a point in my life where I had all these different goals, and I was sending out my resume, and I was thinking about, you know, marriage and eventually, you know, children, and so it's a big setback.
Kimberly believes she contracted the deadly disease during a 1987 tooth extraction. Her dentist, David Acker of Stewart, died of AIDS this past September.
I thought about everything else, and nothing else made sense. The only person that I've been exposed to that had AIDS was the dentist, and I was not in any type of high-risk category.
In between treatment for her disease, Kimberly spends her days with her family and 4 peers, the family birds, even playing piano, trying to relax.
It's not easy, you know, it's something that, it's not like a bad dream. You can wake up and kind of brush it off. It's always there. You know, I wake up and the first thing I think is, am I going to feel good today?
At this point in time, there is no cure for AIDS, and that is a fact Kimberly Brier has to live with on a daily basis. But there is always hope. And today, despite all the cameras and publicity and media attention this case has generated, Kimberly Brier is on a mission. And that mission is to make sure no one else suffers like she has.
New guidelines need to be established to protect the patient and the healthcare worker as well. If you have AIDS or HIV infection, I don't think you should be allowed to perform any type of invasive procedures.
And despite her traumatic ordeal, Kimberly has even managed to find a positive point.
I'd like other people that have this disease, for them to realize that when you have a diagnosis of AIDS, it doesn't mean that you're going to die. It just means that you're faced with a challenge, you know, a challenge to live each day.
Kimberly indeed is an extraordinary.
So we have then in 1990 claimed that HIV was transmitted by a dentist who extracted molars from his one patient. Kimberly Brier stated she had none of the risk factors for HIV, as you saw in the clip. She said she was a virgin, didn't use drugs, had not had a blood transfusion, and she insisted that infection came from her dentist who died of AIDS in 1990. They then tested his patients, I guess over 1,000 patients, and did phylogenetic analysis of viral sequences. I think maybe 10 overall tested positive, but of that, this phylogenetic analysis indicated that Brier and 5 other patients were infected with the same virus. So essentially, it's been accepted more or less that they did get the virus from their dentist. How precisely the infection occurred has not been determined. And in fact, one of Acker's friends claimed after his death and after this it became public, that he did it on purpose, that he infected them because he felt that because most of the HIV infection was in the gay population, that it hadn't received enough attention, and he thought if he infected others that it would come to more general attention. That has never been proven, and it was just a claim by one person. But it still hasn't been determined how they were infected, even though it seems to have been the same virus. And Kimberly Brier obviously chose to go public with her HIV status. And as you saw in the video, her family campaigned for mandatory testing of health workers for HIV and public disclosure, and particularly health workers who are going to be doing invasive procedures. And public disclosure of their status so patients could choose healthcare providers, potentially on the basis of whether they were HIV positive or not. Her father said someone who has AIDS and continues to practice is nothing better than a murderer. The Brier family also did urge testing of patients to protect doctors, although obviously there are some instances where it would be difficult to get the results, even with a rapid test, in a timely fashion. But that was really her campaign. She actually testified at a House hearing in support of a bill that would require healthcare provider testing and disclosing of their status in 1991. The bill didn't pass, but she was wheeled into the House and to talk about her own experience. And they also, in the process of trying to pass the bill, tried to get healthcare providers to list different procedures that would be invasive and where the virus could be passed. But it didn't pass, and she passed away shortly afterwards in December of 1991. Kimberly Bergal's case is really an interesting one. She felt that her status as an innocent victim really was different from other people who acquired the disease through their own actions. And both she and her family obviously expressed resentment to the healthcare profession. I blame Dr. Acker and every single one of you bastards. Anyone who knew Dr. Acker was infected and had full-blown AIDS and stood by not doing a damn thing about it, you're all just as guilty as he was. You've ruined my life and my family's. If laws are not formed to provide protection, then my suffering and death was in vain. So obviously her public announcements and her later actions really brought her case into the spotlight, made it one of the among a number of cases that have been widely publicized, hers certainly was one of the most widely publicized. And it really generated this debate about laws requiring registration of HIV-positive healthcare providers, and also really brought into question the nature of HIV infection and the infected. Because Kimberly emphasized that she was an innocent victim versus the idea of a guilty victim, there's also skepticism about Bergalis and her risk factors, where people were looking, claiming that 2 years was a very short time for the disease to become full-blown, and that we're speculating that she may have lied about her risk factors. And that really has never been resolved, but there's never been significant evidence to indicate she was at risk in any other way. But that question of the innocent versus guilty victim is, I think, significant, particularly in the instance of AIDS, which is an STI, and where you see campaigns really to try to change that idea about the innocent versus the guilty victim, as in the case with this poster, all people with AIDS are innocent. How can someone dying of a disease be considered guilty? Ultimately, so what are some of the longer-term transformations? Certainly prompting adoption of OSHA universal precautions, especially in dentistry. That transformation is one that I remember in my own lifetime, where I remember going to the dentist as a child and they never wore gloves and there was no real precaution, and now it's an entirely different experience. There's a park named Kimberly Bergalis Park in her memory, and then this discussion about the nature of AIDS infection and the innocent victim has been furthered in a play by Lee Blessing. It was actually commissioned by her family, but I think it explores that whole idea of, can you be innocent or guilty when you are sick and dying of a disease? So enduring changes from these cases, certainly in the legal system, we see that in the case of Kimberly Bergalis, that the bill that she wanted most didn't pass, but there was then impetus to really put into place OSHA guidelines about dental care and changes in society. We can discuss how enduring or how widespread you think these changes are, but just as we learn more about HIV/AIDS and see the faces of the people who were positive, society has certainly become more accepting of that disease. So I guess I would end then with a question of, how much change do you think has really occurred, or what are some of the changes that have occurred throughout your lifetime?
Okay, I'm speaking from somebody who lived through that era, and I was actually a medical librarian in the 1980s, and I do remember when they did start requiring, especially in this for state licensure in the state of Florida, CEs for blood-borne pathogens. Before there were always CEs for them while I was a librarian, but it became required. And it's not just in medicine, but it's also for pharmacy and all the healthcare, for all the healthcare professions. And it's one of the few that is required, if not every year, every few years.
Anybody else think of transformations?
I guess for me, it was when I found out that people had AIDS in the beginning, they all died. And now people are living.
So it's changed from a death sentence to more of a chronic disease.
Treatments are certainly given more proactively now, so, and they're very affordable as well. Sometimes free or no cost to the patient. And address some of those issues of mortality.
And so, in part because of the Ryan White Act, which makes it affordable to those who are low income. And certainly early on, they reserved treatment for those who had more full-blown AIDS rather than trying to prevent HIV from transitioning to AIDS. Anybody else? Nancy?
I'm just thinking there's a lot of, in terms of healthcare, I think that the patient's privacy, to keep it, I think that really heightened the idea that you didn't, because there was all this stigma, you didn't, as a healthcare professional, you had to be very careful not to let out that that was the diagnosis, because you knew this equally in terms of being cast out of your church and your school and things like that. And I think that has improved. I'm not saying it's completely good, but has improved.
I know the OSHA universal precautions were really revolutionary. My mom worked as a nurse here in the prison system during that time, and I remember, there's a huge concentration of HIV positive or AIDS patients in the prison system, and there was always the risk of, when she's trying to give meds, but when she's not fully restrained and they're moving needle sticks. She'd had a few needle sticks, and so they had to get routinely tested, and the switching to universal precautions had a huge impact and reduced her fear when she would go to work and was administering meds or anything that might have some kind of contact. But then it also had the effect of latex allergies. As you're moving to universal precautions and using all of these latex gloves, it's when you start seeing a lot of latex sensitivity and latex allergies. And so they would double glove and do things like that because they knew that so many of the prison population had HIV, and she ended up with some pretty serious latex allergies too. So all of these changes still have other consequences.
Okay, I'm going to speak up again. Changes in the blood supply. Changes dealing with, in fact, there was something fairly recently on NPR, a gentleman who is a hemophiliac who says he is one of the few that he had his 60th birthday. And he said all of his friends died in the 1980s from AIDS. And he is the only one that survived from his group. And these were boys that he knew because they were also hemophiliacs. And he said it's kind of really strange that now he's dealing with aging issues, not the hemophilia. And he said the major change was the testing of the blood supply and the development of the artificial blood. He said that he's noticing, he says, now because of that, boys that have hemophilia can actually live a normal life.
And grow up.
And grow up and expect to live a normal lifespan.
I would say, though, that things can swing too far in the other direction, as you saw with the Pulse massacre in Orlando just a few weeks ago. There are still lifetime bans on homosexuals giving blood, and with the population that was targeted in that incident, people were wanting to donate blood, and there's still a lifetime ban, and looking at the science behind that. And is that still necessary? I understand the regulations they put on the blood supply because it went back to all of the hemophiliacs in the 80s, but what is the science behind that now? Is something like a 10-year ban, or do you have to have 10 years of being HIV negative? So going back and looking and saying, okay, they enacted these policies for the safety of people, but how often are they going to be revisited based on the changing science? It was in the news quite a bit in the last few weeks.
And his friends wanted to donate blood.
His friends wanted to donate blood, and they couldn't. And
so I certainly remember, as I said earlier, that the change in just as a person going to the dentist, how that has become, how that has transformed. And I'm sure for a lot of the folks here that going to a dentist and having universal precautions, having to wear gloves, that's all you've ever known because of the changes that were enacted. I also remember the AIDS activism because of one of the things that I didn't really discuss was how changes occurred because of activism, because of people speaking up. And I remember ACT UP, which was one of the groups, activist groups, demonstrations where they were spitting on police at a time when it still wasn't sure can you contract AIDS from saliva. And that was kind of a form of protest. Okay. Well, I think with that I will end and thank you all for coming, for contributing.